writing the thesis, which is 99.5% complete, which is a comparison of flexibility of female collegiate swimmers to recreationally active non-swimmers. That's neat. And I studied under my undergraduate. Thought you'd enjoy that.
Thank you.
So, swimmers usually have hyperflexible shoulders and ankles. So, taking that idea more into it, looking at the more experienced a swimmer, the more flexible they should be. And in swimming, poor flexibility can lead to bad performance or injury. So, the purpose of my study is because there's very limited research about swimmers' hips. If you look at any of the literature about swimmers, it really is about shoulders. Everybody loves shoulders when they talk about swimmers. So I wanted to see what was going on with the hips. And it's to compare hip flexibility in swimmers to just normal, average women in this case, and to add to knowledge of flexibility training with swimmers and see what we can do with them. So I had 3 hypotheses. I had 3 tests to test the hypotheses. But my hypotheses basically were that swimmers would have greater hip flexion than non-swimmers, swimmers would have greater pelvic range of motion than non-swimmers, and swimmers would have greater internal rotation of the hip than non-swimmers. Now I'll show you pictures of what I did to test. So all of my participants were female because we know the differences in flexibility between men and women, also because there are a lot less male swimmers in southern Florida. So I went with just women on that one. They were between 18 and 30 years of age. Recreationally active non-swimmers were from Barry that I offered an approach to the fitness center, as you probably see working up there. And collegiate swimmers were from a Division I and a Division II school in southern Florida. They asked not to be named. Everybody had to have at least 2 years of participation in either they're exercising as a recreationally active person or in competitive swimming, which is not a problem because we have a lot of active people around here. So, my 3 tests were the passive straight leg raise. So we doing it right up there, where the person places a finger on their greater pectoral canter, and they raise their leg up as far as they can go until a stretch is felt and they're not in discomfort. I did the sit and reach test. A lot of American kids do it in school. So same procedure, but did the measuring a little bit differently. Instead of reading what was on the box up here, there's a little box that I'm holding in the picture, and that's so I can measure the pelvic range of motion. So I'm looking at this angle for you. And then I did the internal rotation of the hip. So I would have people sit on the edge of the athletic training table, and I would pull their leg out as far as they could go. And then I would measure this angle right here. I'd have a guideline from where they started. So the instruments that I used, little Sony Handycam, so everybody got videotaped, and the Dartfish software, which probably a bunch of you have used before, and it allows me to measure the angles of everything. And also allows so that I can look at the greatest range of motion and stop it right on there, rather than having to use like a goniometer and having to try and catch the person at the right angle and everything. So, my procedures was that they signed a consent. I collected demographic information about them and about their activities. Everybody did the same warm-up, and the test was done in a counterbalanced order. And that's because with flexibility, sometimes if you do them in the same order, it can affect what the outcome will be. So we had a whole counterbalance schedule to drive the test. So my dependent variables were the 3 tests I just described to you. My independent variable were my 2 groups of swimmers versus non-swimmers. And then I did independent t-tests to compare them. So my results, yay, what you've been waiting so long for. So I had 23 women, 23 recreationally active non-swimmers, and 20 collegiate swimmers. And this table talks all about them. They're pretty much the same. That's pretty much what that table says.
Wait, go back.
Yeah, we gotta look at this a little more.
They're all around the same age. They're all around the same height. They're all around the same body mass.
Okay.
Okay. So, I'm going to talk about how consistent I am, okay? So, internal consistency, my ability to do the tests and to do them consistently within the 3 trials of the 3 tests. So, we have interclass correlation coefficients of my 3 tests, which all came out moderate to high. Interclass correlation range, pretty darn high. and my standard error pretty low. So, consistent. My inter-rater consistency. So, inter-rater means that I was rating things against somebody else. So, rater 1, these are the measurements that I got. These are the measurements that I got when measuring on the dartfish angle tool. This is the measurements of angle of rater 2. The decline coefficient. They're pretty cut down close. This is pretty high, this is high, this is moderately, and this end was pretty low. So, when rated against someone else, I'm pretty darn Intra-rater consistency. So, I got to watch all of these videos twice, which I know you're so jealous of. So, we can see over here. This is the measurements on the first time I did it. Measurements on the second time. That's pretty high, pretty close. Both times, that sounds pretty low. So, we've now established that I'm pretty reliable. Pretty reliable. So, to go back and think about my hypotheses, I was wrong. But I'm a secure enough person I can accept when I'm wrong. So, with the passive straight leg raise and the sit and reach test, the non-swimmers were actually more flexible than the swimmers.
Oh, mercy.
Yep, but statistically, so that's good, at least. So, you can see that at 95% confidence level, the PSLR was significant, and my effect size was very large, so that means that I got enough people, so that's good. My sit and reach was encroaching upon large for the effect size, and was really, really significant. Going the wrong way than I wanted, but and then no difference was found between the swimmers and non-swimmers on the internal rotation of the hip test. So a little disappointing, but at least they got 2 significant results. So, in contrast to what I thought was going to happen, based on the literature, the swimmers are supposed to be these very flexible people to do all the movements of swimming. So flexibility in swimmers is important because it allows for the best positioning while in the water to allow you to be able to bend and breathe and come up out of the water to do all your strokes. But actually, the swimmers having less pelvic and hip range of motion, it's possible that they're chronically hyperextended when they swim. So, like if you're swimming freestyle, if you imagine yourself prone in the water, you might be bending up to be able to breathe, or if you're swimming the butterfly, you might be coming up all the time like this. So it might be that they're just hyperextended all the time, and that's why they're not flexible. So this might be what's happening. So the internal rotation of the hip test didn't really add much to the evaluation, unfortunately, because the reliability was just moderate and the effect size was small, so I just didn't have enough people really to make that test really robust. I only was able to find really one research article that really talked about it, and it was a guy that measured minimum measurements, and his measurements came out to be about 35 degrees of rotation, and that's within normal for what the ACSM says, degrees of rotation. But what I did, I actually found that the swimmers were a little bit higher than the non-swimmers, but they were pretty darn close, and they're all above average, which we would all love to be above. Not all of them can be above average. So my limitations, sample size, it doesn't really apply to the passive straight leg raise because I had an extra large effect size, so that was good. The sit and reach, like I said, encroaching upon large, but internal rotation was very small. So that's kind of a limitation for them, not so much for the PSLR or the SI. The time I was allotted with the swimmers, when I went to one school I only had an hour, the other school I only had an hour and a half, and it was kind of hard to be able to get enough people during that time. And I had no control over what exercise anybody had done during that day or what stretching they had done within 24 hours. I think there was something I could control over, but I tried, but I can't control it. So the practical application of this is that hyperflexibility isn't the problem, which is what I thought was going to be the problem, but it's the immobility of muscles of their lower back and pelvis and hips, and that this immobility might actually lead to worse immobility, pain and weakness, not only right now while they're swimming and having problems, but it also could lead to more immobility when they get older, which is bad, we don't want that. And with this in mind, swim coaches should measure their athletes, or really all coaches, but swim coaches should measure their athletes before, during, and after their seasons for possible changes and implement maybe some stretching with them. When looking through the literature, it's been proven that a single bout of stretching the hamstrings can increase flexibility for up to 24 hours. And also a 12-week stretching program can actually increase the flexibility of the hamstring significantly and create long-term effects. And by increasing the range of motion of the hip joint, it's going to make it easier for them to be able to swim and be able to swim more effectively by being able to move those joints. So that's a million references.
Any questions?
Yes, Dr.
Well, you can go first. That's my
I was
opinion.
just going to ask if you said that you only use women as participants in the study. Do you feel as though because of the fact that women are generally more flexible than men that you might have gotten a different result had you gotten men because it may require them to be just a little bit more flexible than average because they're already not as flexible as women?
I don't know.
Great question.
Yeah, if I had gotten a different result, I might have gotten what I hypothesized by improvement. That also takes time and availability of them now. I mean, like, when I was going through the schools within driving distance of here, most of them didn't have men's teams, so you can't test the guys if they're there.
Well, it's a good question.
All right, now this is a hypothetical, all right? But I'll give you the real, and then recently, I've had both hips totally replaced.
All right.
All right. Thank goodness I live in a time where technology and everything comes
So
together.
we have to
All right, so that said, one of the things that they have seriously suggested that I do is swimming. Now, based upon what you found, and remember, once an athlete, always an athlete. Okay?
Absolutely.
All right, so if I'm seeing this correctly, if they're working on, if they want total mobility of that hip joint, then is swimming really the best thing for me to be doing?
Now, do they say that they want you to swim or they want you to do water exercise?
Well, swim and then water exercises, but swimming for sure, laps are good.
So, my thoughts on that is that they're suggesting both because they want to take the pressure off of your hips. So
Yep.
you're able to do the water aerobics or whatever you're doing upright. So that sounds like that'd be great. The problem that I was running into, I think, is what happening with the swimmers is that they're spending 20 hours a week on their stomachs, but bending up like this, so that's why they're shortening. Oh, I don't know how to do that. Okay, we can do it after. But I think swimming recreationally just a couple hours a week might be able to help to kind of take the weight off of the hips with all of that. Stretch it out.
Okay.
But I think that they're getting stuck that way because they spend so much time in that position, having their backs hypers.
Opposite of cycles.
Thank you, Kate.
Opposite of cycles. Yeah, now it's good.